This is the fourth and final film that tells the story of how I was diagnosed with incurable prostate cancer and suddenly fell into a deep depression. The first film covers what happened after my diagnosis, how I was wrongly diagnosed as psychotic with nihilistic delusions and given multiple psychiatric drugs that made my mental and physical state far, far worse. The second film tells the story of what happened after I was taken by air ambulance to a psychiatric hospital in Aberdeen. The third film tells of my experience of being given forced electroconvulsive therapy with absolutely no preparation, despite continuing to voice my strong objections. This film tells of my recovery despite two psychiatrists lying about my condition at a mental health tribunal and wishing to continue my confinement and electroshock. And because I didn't take the tablets that were handed to me with no explanation on the day that I left hospital, I was given an antipsychotic and 2 antidepressants. My short-term detention order expired on the 26th of December 2021, and the doctors decided to apply for a compulsory treatment order to extend the detention and forced treatment with electroconvulsive therapy for up to another 6 months. The consultant who submitted the form, Dr. M, who was a consultant in old age psychiatry, certified that I was incapable of instructing a solicitor. The second opinion doctor wasn't really independent, as he was married to the ward doctor, who I call Dr. B, and I now know that he had a long telephone conversation with Dr. M. He only had a very brief meeting with me. He also certified that I was incapable of instructing a solicitor. This is chilling, because they were saying that I couldn't have any legal representation at the tribunal and could be deprived of my liberty and forcibly treated with more electroshock. Despite two doctors certifying that I was incapable of doing so, I did instruct a solicitor, who was provided by the advocacy service. I met him on the 29th of December 2021 and on the 5th of January 2022. I was gobsmacked to see what had been written about me. The psychiatrist clearly didn't expect me to see it, and I strongly objected to the order. This is part of the form that Dr. M submitted to the tribunal and that I was able to see before the hearing, because despite her saying that I was incapable, I did instruct a solicitor. Delusional beliefs relating to his physical health. What does this mean? I've been diagnosed with stage 4 cancer, so how was that delusional? He has poor appetite and requires significant persuasion to eat and drink, believing he will commit suicide by starving himself. My notes include records of my food and drink intake, which completely contradict her. On the 21st of December, the day when Dr. M completed the form, I had cereal and toast for breakfast, a 3-course lunch, an evening meal of non-specified main course and a pudding. Before going to bed, I had a sandwich. On the days before and after, my food intake was similar. Look at the lunch that I had on the 21st. I sat in the dining room with my fellow patients and had soup, followed by the Scottish classic of minced beef with mashed tatties and neeps. Then a yoghurt and a glass of orange juice. It's completely bizarre and unforgivable to say, in an expert statement recommending my involuntary detention and forced treatment, that I was trying to commit suicide by starving myself. Why did she exaggerate beyond the point of lying, just as Dr. B had done when she made the request for a second opinion of ECT that I referred to in my previous video? If her evidence had been accepted uncritically by the tribunal, I would have had no representation and would have been held against my will for up to 6 months and forcibly given more ECT. This makes me very angry and seems to me to be professional misconduct. Dr. M also included this farcical statement in the diagnosis presented to the tribunal. It would be laughable if it wasn't potentially so serious for me. I was expressing a wish to commit unconscious suicide, as he states his bowels are blocked and he will fill with feces and die as a result. It seems contradictory to me that a wish can be both expressed and unconscious. I was seriously worried that I hadn't had a shit for 3 weeks since entering hospital, something that I didn't know was possible. I now know that severe constipation is one of the most common side effects of Olanzapine, made worse by having absolutely no exercise and by the other drugs that I was made to take, all of which list constipation as a side effect. This is the information about Olanzapine on the NHS site. A search also produces various journal articles about the effects of antipsychotics on the gut and the severe constipation that they can cause. They're all rather complicated and difficult to summarise, but this is just part of one of them. On the same day that Dr. M said that I had a wish to commit unconscious suicide by filling with feces, the ward GP took my complaint of constipation seriously at last. This is a note by Dr. Gerard made on the 21st of December. Again, it's the same day that Dr. M said that I had a wish to die by filling up with feces. Complaining of constipation, no bowel movements since coming to the Royal Cornhill Hospital. Plan: glycerin suppositories and phosphate enema. Restart Laxido at double dose. Here are the nurse's notes, written in the early hours of the 22nd of December, describing the results of the suppositories on the evening of the 21st of December. Was seen by Dr. Gerard and given suppositories. Passed 2 large amounts of stool. The application for a compulsory treatment order required an examination by a second medical practitioner. That practitioner was the husband of Dr. B, and as I mentioned before, the notes record that he had a long telephone conversation with Dr. M before meeting me briefly, although he certified that he'd examined me separately from Dr. M. Here are some excerpts from what he notes. Clear evidence of severe depressive illness and psychotic, nihilistic, delusional beliefs. Depressive delusions physical health. Why does he say that when I've been given a diagnosis of incurable cancer? And how is that delusional? Depressive cognitions and delusional beliefs drive ongoing suicidal intent and nihilistic drives. That suicidal intent and what a nihilistic drives. Anyway, due to the nature of his depressive illness and the delusional beliefs, Mr. Blank is not capable of making decisions re his need for medical treatment. Also, decision-making retreatment is significantly impaired. He also certified, due to delusional beliefs, not able to instruct a solicitor re his needs. So, if the expert evidence of the psychiatrists had been accepted, I would never have read and challenged what they wrote about me. My incarceration would have continued, and they would have forced me to have more sessions of ECT against my clearly expressed wishes. I wonder where I would now be if the tribunal had believed them. Thank God the advocacy service did find me a solicitor, and I met him to instruct him on the 29th of December 2021 and on the day before the tribunal. The tribunal was held remotely on the 6th of January 2022. The consultant was still on holiday and a staff nurse gave evidence about my mental condition. To my immense relief, the order was not granted and I was free. Looking at my notes, I can see that the doctors were not pleased that they could not compulsorily treat me. The poor deluded Dr. B told me that there was a risk of relapse if I didn't continue with the ECT. After winning the tribunal, my situation changed immediately. I could go out of the ward once or twice a day to get exercise and fresh air. I walked a long way, as far as the centre of Aberdeen and the harbour, and to Old Aberdeen in the opposite direction. I got my wallet and bank cards back and found that I had £14,000 in my current account because my cousin had sold an expensive motorbike that I'd owned. I bought new clothes and had a haircut. I bought a phone, a MacBook and a radio so that I could have contact with the outside world and start to sort out my finances. I decided to cut my losses and contacted an estate agent to put a property that I've been working on the market. I bought books and ordered more online. I went to the art gallery and the local archives, and I had coffee and cake in many cafes. The twice daily reports by nurses show an instant change from the evening of the tribunal onwards. I will show some quotes, but the notes become repetitive because every one of them is positive, and there's absolutely no references to low mood, nihilistic speech, or anything else negative from the evening of the 6th of January onwards. On the 6th of January, the nurse noted, "Has appeared bright, engaging well with staff and fellow patients, and there's been no evidence of low mood." Jay's CTO tribunal hearing was today. In the absence of Dr. M, who's the consultant, nursing staff attended to give evidence. Jay has expressed that he no longer wishes to receive ECT treatment and feels that it no longer benefits him. He also boasts that he's lost faith in Dr. M following her medical report. I never saw Dr. M again, which doesn't surprise me given her arrogant attitude towards her patients and the lies in her submission to the tribunal. This is the 11th of January. Mood bright and chatty with staff. Physiotherapy at 11 o'clock in the morning. Patient has been independently mobile with going across to Sainsbury's. No concerns. Discharged. A note in the afternoon. Spending his day going off the ward for walks and to the shops. This is the 13th of January, written in the early hours of the morning. Now being informal, went on shopping spree buying clothes that he could call his. New boots, books and laptop. Reported tremor and blurred vision. Would like to discuss coming off medications. This is in the afternoon. Has utilised his time off ward. He bought some new clothing while shopping. Voiced enjoying his trip out as he managed to stop off at a cafe shop. He said he sat and had coffee and a cake. He also voiced having a look online at new reading books and placed an order for a few. This is 24th of January. Jay spent most of evening on his laptop in his bed space, pleasant on approach. This is in the afternoon, utilising time off ward appropriately and keeping himself busy while on ward. This is the 5th of February, in the early hours of the morning. Jay spent evening on top of his bed, looking at his laptop and reading books, talking about being into town and going to art gallery for his coffee and cake. The doctors weren't so happy. On the 10th of January, this is Dr. B, much better than last review, secondary to medication and for ECT. Well, that's, in my opinion, it was secondary to recommending some of my liberty. Refused last treatment and continuing to refuse, despite efforts on my part to encourage a further 2 treatments. Wanting his Olanzapine reduced, reporting it is making him fuzzy-headed and eyesight deteriorating. Plan. informal, brackets, no medical representation at tribunal, close brackets, as if I'd only won the tribunal because none of the doctors were there. Not willing to have further ECT voluntarily. He is much better, but is at considerable risk of relapse. Not keen on Olanzapine, and clear he wishes this reduced or stopped. This is the 14th of January, the ward doctor, the ward GP. Still complaining of vision problems, blurred vision. Refer to eye clinic for glaucoma review. Well, this never happened. Drugs.com gives blurred vision as a possible side effect of Olanzapine and is probably the cause of my blurred vision. This is another doctor on the 19th of January. Mood objectively and subjectively euthemic. No evidence of any psychotic symptoms. He describes bilateral hand tremor and a fuzziness in his brain, which he attributes to medication. I have explained that any reduction in medication would have to be gradual, and that there is a risk of relapse of his illness with any reduction. This is the 8th of February, Dr. B. Reviewed prior to ward round, mentally well, tremor bilateral and feeling slightly stoned, even before recent introduction. I think she means reduction of meds. So Dr. B had told me absolutely nothing about the drugs that I was being made to take. She didn't tell me their names. She did not tell me when she increased the doses. She did not warn me of any side effects. She did mention Olanzapine when I complained about my hand shaking all the time, but she didn't tell me anything about it. On the 16th of January 2022, I asked a nurse to tell me the names of the drugs that I was being given. By that time I had a MacBook and could Google them from my hospital bed. When I was eventually discharged, Dr. B had still not told me anything about the drugs. It seems unbelievable to me that as a voluntary patient in an NHS hospital, I had to ask a nurse to tell me about the drugs that I was being made to take, and had to find out about them by Googling them from my hospital bed. This seems to be indicative of the attitudes of the doctors who treated me, perhaps because they're specialists in the psychiatry of old age. I still believe that I had terminal cancer and could not expect to live long. On the 31st of January, I had an appointment at the Aberdeen Royal Infirmary to meet my oncologist for the first time. I found out that I did have an aggressive cancer that had spread beyond the prostate. However, it did not spread to my bones, as I was told in Lancaster, only to some lymph nodes. This was serious and incurable, but with the addition of the drug abiraterone and a course of radiotherapy, there was a good chance of extending my life for a few more years. This was the first time anyone had told me this. My notes say several times that I was concerned about my eyesight, but nothing was done about this apart from giving me my regular eye drops. I have bilateral glaucoma, and while I was in hospital, the sight in my left eye deteriorated to the point of blindness, possibly because of the drugs that I was given, or possibly following the episode of blurred vision that I'd experienced in Shetland. This was interpreted as psychosis and never investigated. I can now see almost nothing through my left eye. As a voluntary patient on drum ward, life became much more pleasant. The nurses were generally kind and helpful. I had books and a MacBook and a radio for entertainment. I could send emails and make phone calls. I had reasonably good food, new clothes that I could wash or have washed, a bath to soak in when I wanted to, and a city to explore. I didn't like the fuzzy-headed feeling of the drugs, or the shake in my hands, or the deadening of emotion, but it was much, much better than the previous confinement. A few minutes before the transport to take me to the airport arrived, I was handed a paper bag with boxes of pills from the pharmacy, still with absolutely no information from a doctor about what they were, how to take them, and how long to take them for. Dr. B recorded on the 16th of February, "Have tried to see J several times this AM. He is clearly out of the ward. Arrangements have been made for discharge tomorrow." That evening, I opened the bag and read the labels. I decided not to take them. This was partly because no doctor had told me anything about the tablets, why I should take them, and when and how to stop taking them. All I knew about them was from Google after I'd asked a nurse for their names. I believe that this is medical negligence, not to tell a patient about the life-changing effects of these drugs, the side effects, and how to withdraw from them safely. I've since found there are over 16,000 members of Facebook groups for people trying to withdraw from Sertraline and Mirtazapene and trying to cope with their side effects. I also hated the drugged feeling of being slightly stoned all the time and not being able to feel my emotions fully. It was my strong instinct that these drugs were harmful, and that instinct was correct. I still have the tablets as a souvenir of my involuntary drugging, all unused. Here they are. This is Mirtazapine, which is still at the maximum dose of 30 milligrams, so they hadn't attempted to reduce the dose while I was in hospital at all. This is Sertraline, and again, I'm instructed to take 200 milligram tablets twice a day. No, I'm instructed to take 2 tablets in the morning, sorry. But again, 200 milligrams is the maximum dose, and they'd had no attempt at reducing them while I was in hospital. And the final drug was Olanzapine, and that one was 7.5 milligrams. So they had halved that dose, presumably because of my continued complaints about shaking hands and blurred eyesight. I was lucky in not suffering any ill effects of abruptly stopping the drugs. My depression had run its course as I came to terms with my diagnosis on my own, despite the brutal treatment with drugs and electroshock. Instead of any noticeable withdrawal symptoms or any relapse of depression, I actually felt much better, more clear-headed and less emotionally blunted and indifferent. I spent the next few weeks travelling to Shetland, to England and to Europe. I'm self-employed and started working again. I was back to normal, and apart from a few close friends, no one had noticed that I'd been absent for a few months. I've since joined prostate cancer forums and seen other men and their partners describing how devastating the mental effects of diagnosis can be, particularly drawn-out process of tests before a treatment plan is arrived at. My diagnosis came at a bad time for other reasons, and I was given absolutely no information about cancer support services when I needed them. At the time I had no partner, relative or friend to go with me to appointments, as many people are lucky to have. Instead, when I tried to get help, I was treated as a case for the overstretched old age psychiatry services. If I'd been given the right support at the right time, the trauma of involuntary incarceration and inappropriate forced treatment and the cost to the NHS could have been avoided. I now know that there are many cancer and prostate cancer support services and groups, but I wasn't referred to any of them. In Patting the Shark, Tim Baker, an Australian surf journalist, describes the devastating effects of his diagnosis and the insensitive way in which it was delivered. He quotes a study of cancer patients that found that 74% of patients in the study experienced severe distress after their diagnosis, and 55% were found to be suffering from post-traumatic stress disorder. He imagines an alternative where there is a supportive team available at the time of diagnosis to provide information and advice. They should never have loaded me with such powerful drugs in Lerwick, should never have started me on antipsychotics, and should never have recklessly increased the doses so suddenly. The efficacy of antidepressants and antipsychotic drugs and their potentially devastating side effects is a highly controversial subject. From what I have read, it seems that there is little sound evidence that they are effective, except in limited circumstances, and a lot of evidence of the harm that they cause. But this is a whole other topic. I was depressed, but I was falsely labelled as psychotic, and it's frightening to experience drugs that made it impossible to think and express myself clearly, and just made me much more depressed and apathetic. When I got to Aberdeen, the fundamental causes of my depression were never addressed or even discussed. It was treated as if it was a physical disease, and any non-compliance and expressions of low mood were symptoms to be treated with drugs. I only started to recover when I had the freedom to address some of the causes myself. Unlike other branches of medicine, psychiatry has no scientific tests, just the opinion of a doctor after speaking to a patient, and just more and more drugs followed by electroshock. Most astounding is that the doctors responsible for my care lied on the official forms authorising forced treatment, in the expectation that I would never be able to see what they wrote or to challenge them. Perhaps this is how they normally treat their old age patients. Dr. B lied on the form requesting a second opinion for ECT, tripling the time that I'd actually been unwell, not mentioning that I'd been treated with drugs for less than 2 weeks, saying that I was refusing to eat or drink or take medication when this wasn't true, and saying that, as a stage 4 cancer sufferer, I had nihilistic delusions. Much worse, a second opinion doctor authorising ECT, Dr. Rook, blatantly lied on the official form that he filled in, saying that he had examined and consulted me, which he was legally obliged to do, when he hadn't. This is serious professional misconduct. Dr. M, the consultant and old age psychiatrist, lied on the form that she submitted to the tribunal, saying that I was trying to commit suicide by starving myself on the same day that I'd attended all meals in the dining room and had breakfast, a 3-course lunch, a 2-course evening meal and a sandwich supper. She also made the ludicrous claim that I wanted to commit unconscious suicide by filling with faeces and dying as a result, also on the same day that the ward GP took my complaints of constipation more seriously at last and gave me suppositories and an enema that produced results. After I won my liberty at the tribunal, Dr. M avoided seeing me again, despite supposedly being the consultant in charge of my care. Anyone visiting Drum Ward or meeting Dr. B will think that it provided a caring environment, which it did as far as the nursing was concerned. She was a middle-aged lady dressed all in black and had waist-length hair and a special sympathetic voice for talking to patients. What wouldn't be apparent is her arrogance in using forced drugging and electroshock with an almost evangelical belief in her right to do so without telling her patients anything, and based on her unscientific assessment of their mood. I feel sorry for my fellow patients swallowing their pills morning and night and shuffling between their bed spaces and the dining room every day. Their relatives and any inspectors from the Mental Welfare Commission for Scotland might see the environment provided by the nurses and see no reason to challenge the care being provided. I feel hatred towards the doctors, particularly Dr. B, for what she did to me, and the cowardly way in which she did not prepare me in any way for the traumatising experience in the ECT suite, her patronising manner, and the way in which she let me leave hospital with no information whatsoever about the drugs that were handed to me. ECT is highly controversial and barbaric, but should never have been given to me, and it should never have been given to anyone in my situation with no history of mental illness, and it should be banned altogether, as it has been in some countries, as the more that I read about it, the more that I'm convinced there is no scientifically valid justification for its use, and many examples of the harm that it causes. Thank God the tribunal were not convinced by the psychiatrist's nonsense, and the advocacy service found me a solicitor who would argue for my liberty. Thank God I didn't take any of the tablets when I was discharged. I now know that they could have shortened my life. I have monthly blood tests, including for liver function, because of the cancer drugs, particularly abiraterone, and I have a higher than normal risk of heart disease and stroke because of this treatment. So far the tests have been satisfactory, but all the psychiatric drugs that I was given, particularly Olanzapine, can seriously affect the liver, kidneys and heart. If I'd continued to take them, it's quite possible that I would have had to switch to a less effective cancer treatment because of liver toxicity, and I would have been at a higher risk of having a heart attack or stroke. The doctors at the Royal Cornhill Hospital were negligent in telling me nothing about the drugs. It's now 3 years since I was told that I have incurable cancer. I'm not depressed. My type of depression would almost certainly have resolved itself with time, and by addressing its causes anyway, without the heavy-handed medical intervention and incarceration that made it so much worse. Every 4 weeks I have my blood tested and blood pressure taken at a hospital 15 miles away by friendly nurses who see me almost immediately I arrive. Every 6 months I have a CT scan at the same hospital, and every 3 months I have an injection of triptorelin administered by the nurse at the local doctor's surgery, which takes less than 10 minutes to walk to. I'm lucky that side effects of the treatment are not as bad as some people report. After all this time, I still have some sleepless nights when the memory of the forced ECT returns, and I can't find any way to shut it down. I try to keep physically and mentally healthy by the obvious means: exercise, nature, eating well, relationships, and mental stimulation, none of which were provided in hospital. I now know that I will never be cured, and that at some unknown time, which might be weeks or years away, the androgen deprivation therapy will stop working, and the cancer cells in my body will find a way to start growing again. It's something that I deal with on my own and with my partner. The time when support groups or therapy would have helped has passed for the time being. What I am certain of is that I will never forgive the bastards who drugged me, then assaulted me with electroshock.